Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you a seated exercise for improving your bend, improving your knee flexion after surgery. So all you need is a chair that you can sit in, and for this exercise, you're going to want to be able to slide your foot on the surface that you're on. So for me, just wearing socks, they tend to slide pretty well on the carpet here. They'll usually slide well on a hard surface floor as well. If you don't have socks, you can use a furniture mover. So those sliding furniture movers work well. You could try a glossy magazine, like a cover of a magazine, and put your foot on the magazine or the top or the cover of it. You can try a plastic bag and wrap that around your leg too for just some different options. But most of the time, just a nice sock and the surface that you're on tends to slide pretty well. And what you're going to do is you're sitting in a chair and you're going to be in a good upright position with about half of your thigh off the edge of the chair. So we don't want you sitting back all the way like this. We want to be forward with about half the thigh, maybe a little bit more, off the edge of the chair. So there's some room so that you're going to then bend your leg here in a minute. Start with your leg out in front of you a little bit. It doesn't have to be perfectly extended out like this, but just out a little bit in front of you to start in a nice comfortable position. And then what I like to do is if you have armrests or if you have the bottom of your chair just to hold on to keep you stable and stay in a nice upright seated position. And then all you're going to do is slide your foot back toward your body and eventually underneath your chair as you improve your motion. At some point, your heel is going to come up off the ground, and that's perfectly okay. And also at some point, you're going to notice you're going to get to a point of sticking where you can't bend the knee any further. And what you want to do then is use the opposite foot. You can actually use the heel of your opposite foot, and you're going to push on that shin, and you can give an extra little push and an extra little nudge into knee flexion. And then you can let that relax back out. Now, if you've seen my other videos on knee bending, I always like to start with a little bit of a warm-up instead of going right to your maximal knee bending right away. So for example, just doing some gentle bends, partial range of motion, basically coming only up to maybe 90 degrees, maybe not that much more of knee flexion, and just doing some repetitions, this continuous smooth motion initially to warm everything up, to increase some fluid to the area, and just get you a little bit more comfortable with this exercise. Then after you do that for maybe a minute or two, everything's warmed up a little bit more, then you can go into trying to get that maximal knee bend. So again, trying to bring that foot all the way back, letting the heel come up. When you get to that sticking point, give yourself an extra little push. I like to hold that for maybe 8 to 10 seconds or so, and then slowly let the foot come back out. And you can actually use your opposite foot on the back of your leg to help bring that foot back out a little bit easier. So for number of repetitions, number of sets, what I usually like to do is start with 1 or 2 sets of just those easy slides back and forth, not trying to crank into increase your range of motion, just getting a little bit of bending and straightening of the knee. Then I like to do maybe 1, 2, maximum 3 sets of these pushing back to your maximum out, hold for 8 to 10 seconds, and then relax. So I'll usually do 1 to 3 sets, 10-second holds each time I come back. This has been seated knee flexion, a great exercise for improving your knee bending range of motion after knee replacement surgery. Be sure to hit that like and leave a comment if you got something useful out of this, and be sure to subscribe to catch all our videos of different exercises, different frequently asked questions, details of surgery, preparation, recovery, and everything else in between. Thank you very much for watching.